Welcome to the Aesthetic Angle Podcast, soon to be the #1 podcast for all things related to plastic surgery, skincare, and wellness in the Kansas City metro and hopefully broader region coming soon. And I'm very excited today to present to you two of our wonderful estheticians, Jess Hager and Sharina Ostmeyer. We have 6 estheticians here at Monarch, and today is actually National Esthetician Day. Woo, woo, woo. So Jess and Sharina are sporting some really slick new black scrubs. Which is sweet. And with matching Nike kicks, which you probably can't see. But
we didn't plan the shoes, we planned the scrubs.
Super dope. I need to get some black and white kicks to match you guys. So anyway, we're heading into fall, which is historically a great time for people to start thinking about skincare and recovery when they're not playing out in the sun and things like that. So we'll talk about a broad array of topics today, and thank you for tuning in. So let's see here. What are some of the most common types of skin damage people experience after summer, and how do you identify them?
Well, the summer brings out a lot of old pigment, and sometimes it can re-damage current pigment too. So sun damage is the biggest thing that we see after summertime, and even reds in the skin from the heat can inflame the skin. So sometimes it can make rosacea flare up a little bit too. Okay,
so rosacea. What other things mean sun damage to you? It's like your average person looking in the mirror, what can they look at and be like, oh, I think that's sun damage?
Dry skin is a big one.
Okay.
But most of the time you're going to see some melasma, pigment, age spots.
Okay. Yeah. What is melasma? What people often call age spots?
So melasma is a skin condition.
Okay.
But the sun makes melasma come out and be more noticeable. So in the wintertime, we can treat your melasma, get it kind of under control. It's always going to flare back up. So it's important to do your fall and winter treatments then sunscreen, in the summertime.
And it's a lot of little dark spots, right?
Melasma's patchy. Yeah,
it's
a larger pigment typically.
Thank you.
Sun damage can be small. I mean, it can be an array of different sizes, but usually melasma can be hormone based. It can be
usually shows up like across the forehead,
cheeks,
and then into the cheek area.
Yeah.
Okay.
And wrinkles is a big sign of sun damage too.
Yes.
Sun ages us the most. Outside of even smoking and pollutants and everything, the environment, the sun ages us the most. So that would probably be pigment, and aging is the biggest notice of.
It's responsible for 90% of facial aging, right?
Yeah.
UV and damage.
Yeah.
At least that's what I remember reading in a book.
Yeah. I like that.
Yeah. I meet people, even guys, they're like, I put on sunscreen when I go to the pool. I'm like, no, dude. Like,
it's,
Or the big one is, well, I put it on this morning and it's 6:00 at the baseball game. And you're like, but did you reapply?
Did you reapply?
Well, no, I just put it on in the morning. I'm like, well, it doesn't.
Right.
You need to reapply. Reapplying is the big one. Yeah, There's this picture going around. I think it's maybe Color Science, but it's a truck driver.
Yeah.
And have you seen that one? Where half of his face from the sun, it looks like it's significantly aged. Yeah. It almost looks like it's melting. Sorry, guy. And then the other side is just normal aging, but it's almost just like a split thing because, he spent his whole life driving in a truck and getting sun damage from
that. We call it driving pigmentation.
Yeah. Oh, yeah. The driver.
When it's on one side?
Mm-hmm. The driver's side.
It's your driver's side.
No kidding.
Or a passenger princess.
Yeah.
On the right side.
Which would be your right side.
So which side do you get, Sharina?
The driving side.
You don't have to answer
that.
Well, not a passenger princess.
I mean, I can be.
Yeah.
Got it. So when people start thinking about how to improve the texture of their skin, some damage, whatever, I mean, there's like hundreds of things that come up in a search. So one of the big things that can help a lot would be lasers, right? Or light therapy things, we'll say, not necessarily even lasers. So of like the broad array of options out there, can one of you talk about first how those things help, and then can you combine different modalities?
Absolutely. So I'll just start, like, the big daddy of the lasers is halo. So we offer a halo, great treatment to do post summer. But we want to do it after you haven't had a lot of sun. So we need to wait into October, November is the perfect time to do it. So it's a complete resurfacing. So it helps with fine lines and wrinkles. It helps with that pigmentation. The downtime is significant. So if somebody isn't wanting that much downtime, we would steer them to like Moxie, which is our new baby. That we love. We love her so much. So it kind of depends. We ask a lot of people, you know, what's your downtime? Do you have an event coming up? You know, and so there's so many things that can steer a person one way or the other.
And are those both lasers?
Both lasers.
So what's halo? What kind of laser is it, or how deep is it treating?
Halo is a hybrid laser, so it's going to combine non-ablative wavelengths with ablative wavelengths. Moxie is non-ablative, but it's doing very similar things as a halo, but not ablating the skin tissue down. And the depth varies on the person, you know, and the settings, you know, that they need for that time. That's why everything is always so customized.
Sure.
And for my patients, I recommend, you know, 1 halo a year. It is healthy to, I know it sounds kind of scary, but to burn off that skin.
Yes.
So it helps create new healthy skin, not only for anti-aging, but just for oxygen circulation too. And when you've kind of removed that old dead layer of skin, then the products you invest in work better as well. Sure. So, you know, Moxie's a great one if you're not wanting all that downtime. Like I said, it's kind of like a babyier version of a halo, but you may need to do more of those in a series or spread out depending on the person.
And Moxie, you said, is non-ablative.
It's non-ablative.
Can you explain to our listeners and viewers the difference? How do you explain it to patients?
Ablative is like burning the skin down.
Yeah,
it's using an ablative laser to literally kind of resurface that skin down. Non-ablative doesn't do that. It's using more of like the light energy. Yeah.
Now you can stack them, which is really fun to do. So you could do a halo and top it off with a Moxie. So it's getting
right at the same treatment.
Or BBL
Hero
and a Moxie. I mean, it can just
we can do anything.
Yeah. It's like mixing your own little
it's like
cocktail.
A little potion.
Yeah, it's like a little potion. Like
and it's all based on the patient's needs, where they're at, where they want to be, and how much downtime.
Yeah, and it could change year to year too. So, you know, people are like, well, I didn't respond the same way I did last year, or I responded more or less. And there's so many factors that play into that. But it's just always customized to what you need at that time.
What about skin pigment, like darker skin folks versus lighter skin folks?
Moxie's great for that.
Moxie
and Halo
do
too.
All Fitzpatrick's.
Moxie can?
Moxie can.
Oh, you said Fitzpatrick score. I wonder if our listeners know what that is. There's so many things.
Yeah, I know.
We could have a 30-minute discussion with just
I know. Back. You're going to have to invite it back.
It's like your skin score color, I guess. And we just kind of use it to gauge off of, you know, your skin color.
The energy.
So it's 1 through 6, right? 6 is like dark skin.
1 probably
like
being
a native Nigerian person.
Yes.
And 1 is like a blue-eyed, flaxen-haired
me.
Jess. Yeah.
And everyone else is somewhere in between. Got it.
Yeah.
But we have options for everyone.
We do. And that's kind of the fun thing is we've got so many different things that we can do for patients and products too. So,
and I think that's something that's really special about a practice like ours is we can give patients often what they need, not necessarily what we have, you know, because we have a lot of options. So like someone comes and sees me for something, but they really just need a good laser procedure with you guys, you know, or they could use one with me, but they don't want the downtime of the more aggressive erbium laser that the surgeons would use.
Exactly.
Anyway, you talked about stacking treatments. Why is fall a good time to start thinking about this stuff?
Well, the sun's not as strong.
Okay. So sun matters during recovery?
Yes.
Yes, because think about it, like the halo, for example, again, burning that skin tissue down. You don't want that burnt skin or new skin that's coming through to be exposed to the sun.
Sure.
Now, with that being said, we do still do some of these treatments throughout the summer for patients who can avoid the sun. And think about all these other states that are sunny year round.
Yeah, right.
They do these things all the time year round, you know, and the sun doesn't really take a break there.
Yes,
You just have to be mindful. And then we've got a lot of clients who travel, you know, snowbirds and stuff like that too. But usually it's because of the sun. The sun's not as strong when you live in an area like the Midwest with 4 seasons. And
you're not side out a lot, especially here in the Midwest. So your kids aren't playing soccer and, you know, things like that. So you're more inside.
So you're just by default a little more protected.
Yes.
Got it.
Yeah. And it feels better to walk outside on a snowy day after you've burnt your skin than it does on a hot July day.
Roll your window down.
Oh, that's funny.
I did that one time after a halo. It was February and it was snowing, and I had the window down. I had my head out like that a couple of times just to have that cold air because I wasn't going to turn the AC on in my car, but I stuck my head out the window. That's a thing. Yeah.
So that'd be on the way home. So what do people usually do, like to prepare for the procedure? Like, you know, weeks before, morning of?
It's kind of like with you when you are going to do a facelift or something. It's going to be easier for you to cut healthy skin. So come in prepared. Like for my patients, I'm a big believer in let's get your skin prepared for something like a halo. So if a patient comes in and they've never been touched or they don't know what skincare to use, I want to educate them. Come in, let's have a conversation. Let's maybe do 3 or 4 hydrofacials and get your skin prepared for that. Get you on good skincare, and then we can start burning your face off.
Yeah.
So,
what's the hydrofacial do? Does that help you prepare? For more aggressive
So
stuff?
the hydrofacial is a great facial. It is a machine. It's one of my favorites. I've been doing it 17 years. I'm very passionate about it. It gets the skin very, very deeply clean. There's a peel involved, so it's a good peel for everybody. Sensitive skin, rosacea patients, anybody can do it. There's extractions involved. So instead of actually physically doing extractions on people who sometimes don't want to be hurt that much, or teens or something like that, the machine actually does it and pulls it deeper out than I ever could.
And it collects all that
and
junk.
It collects all of it in a gunky jar. You can see it. It's my favorite thing to show you your gunky jar at the end. Very hydrating, but just a really deep cleanse. So it's great to do, you know, the day of a wedding, mother of the bride type of thing. Bright skin, go from monarch, from your facial to the makeup chair, literally. So,
nice. Okay.
And even hydrofacials are great. I usually have my patients come back for one 4 weeks after something, really anything that I'm resurfacing the skin on. But just because, you know, when you do that with lasers, it can dehydrate your skin quite a bit. And so hydrofacials provide a lot of antioxidants and nutrients back in, and it just kind of bounces it back. And so I usually like it for like a post-care treatment too. And think about, you know, your pre-care, when your skin's in a healthier state and you're using all the right things, you tend to heal better too. Your recovery, you know, can't promise that it will shorten it, but it will sure make it a lot easier, and you'll be happier with your results at the end.
Okay. Lovely. So what about the procedure itself? Because some people have heard, you know, maybe that's not comfortable. How do we get patients through these procedures? Sometimes
I really feel like it depends on your pain tolerance.
You tell them you're going to burn their face.
Patient dependent. I have some people. I had one lady that's kind of sleep through it a little bit.
Yeah, I've watched a deep one.
Yeah.
We probably are talking about the same one.
I think you were in there with
where
me.
she talked the whole time, didn't move, and then I've watched.
I'm like, "Are you okay?" She's like, oh, "This is great."
Yeah, I've watched another that was a very minimal one.
Okay,
like we had to stop because she wasn't able to tolerate it. So it just kind of depends.
We numb.
You are numb.
Topical numbing.
Yeah, but it's hot. A halo is
it's
hot.
warm. Yeah.
So
Okay.
and it's a very temporary.
There's a fan.
There's a fan, and you can ice your skin afterwards. It's a very temporary discomfort.
Yeah.
And everybody kind of experiences it. For me, I don't like the downtime's more annoying than I feel like the actual treatment is.
Sure.
And then for people, they're like, oh, I can handle the downtime, which I can handle it, but I can handle the downtime, but the actual treatment itself was, easy, so, or unpleasant or whatever. So yeah, it's just, everybody's got different pain tolerance.
Were you being generous because there's a male in the room that you said there's a diversity of how tough people are?
And
well, I did your Moxie,
and
you squirmed more than your wife did.
Yeah.
you did.
Yes, I know, I did.
But that heat for some people is just it's spicy,
yeah.
you know,
especially if you are fair and you are like, I respond to heat, you know. I wash my face and I turn bright red, and so when my face turns red and it gets heated quicker, then I hold on to that heat and it is a little more uncomfortable. It's very temporary.
Yeah. Okay. And it's nothing to be
scared
of.
Men are wussies.
Men are big wussies. Even with extractions.
We need to hold hands. Yeah, extractions.
Okay. How did you, well, I mean, you tell us, how did you do? What do you think? You did a
spicy,
Moxie.
but I breathed through it, and I knew that I was being a wuss.
Your forehead is really spicy. And I always warn people with that because it's bone. You know, you're fattier down here, and you did good on your neck.
Thanks.
Good on your neck. But your wife was a rock star.
She did. She slept it out.
Took a nap.
She pretty much did.
Enjoyed the downtime.
That's her only piece of the day.
Yeah. But it's such a fast treatment. I mean, you can get a face and neck done in what,
quick. You just
8
breathe
minutes.
through it.
It's ridiculous.
Yeah, it's very fast.
Yeah. Yeah. So, I mean, if you are kind of, by the time my patients are starting to wiggle a little bit, I'm done.
It's time to be done.
And then they're like, oh, that was it. That wasn't bad.
Yeah.
That's what I hear at the end of a lot of these.
Yeah.
It wasn't that bad.
Yeah.
And I think it is a lot of scary people go down a rabbit hole. They look on YouTube and they look at other bloggers and influencers and all these people that, you know, outside of our realm post these things, and it can, scare them.
Or they went somewhere where they didn't get, numbed appropriately.
Or they had a friend.
I think we have a really
good numbing cream.
It's
really good.
Prescription strength.
Yes. It's compounded.
Yeah, it's compounded.
It's great.
It's MD prescribed. So that's probably part of it.
Yeah. It's not that bad.
It's not that bad.
With the extraction, so do either of you like squeezing blackheads off of your partners?
Love it.
Okay, I think I would bet that
more clogged,
every
the
single
better.
esthetician enjoys that.
Yes,
in the world.
One that has
it's very satisfying.
Yeah, it's very satisfying.
Yeah. Yep. I'll pin my daughter down.
I feel like that could be an easy sort of high school question when people are figuring out a career choice.
Yeah,
and it'd be like if they say yes, it's like we've got the job for you.
Yeah.
What are some myths or misconceptions about post-summer skincare that you'd love to clear up?
Well, a myth, I guess it's maybe more so during summer, is stopping actives and retinoids and things like that in the summertime. You do not have to stop your retinol during the summertime. If you wanted to back off and be low maintenance, then we can walk you through what that looks like, so you are still getting all the benefits of your retinol or your hydroquinone or whatever you're using, but don't stop your product.
And stopping it can actually do more damage than being more mindful and coming to us and finding out how we can help you not stop it.
Because then their skin's more irritated when they come to us in the fall time because they just started up on all their products again. And it's like, no, don't. And I can understand why they think that, with the retinol and sun sensitivity. But if your skin's used to the products you're using, you do not have to back down and stop.
What should they do if they're worried about sun and using the retinol?
Sunscreen, hats.
Reapply the sunscreen.
And what's good about, what should they look for in a sunscreen?
I personally like mineral. Yeah.
Mineral.
Yeah. It allows you.
Usually zinc, but there are some titanium out there, right?
Yeah.
The chemical, I had a patient who told me she had a good sunscreen. I still give her samples. And it was 2 weeks after a Moxie. And she called me and she had given herself a chemical burn because her sunscreen was chemical, not mineral. So she was fine, but it just kind of re-flared up from that laser. So laser patients have to be so mindful and very understanding that I want you to use this sunscreen for a reason. It's only going to protect you. And I'll give samples out all day long. If you don't have it, I'll give it to you. Yeah. We want you just to be protected.
Sure.
So. And minerals allow your skin to breathe. So post-care, really any treatment, but especially after a laser when your skin's been compromised and you've got all those open channels in your skin, you don't want chemicals inside of those channels, and you want your skin to breathe so it heals. Yes. It doesn't harbor bacteria. So there's a lot of reasons why personally like a mineral.
Yeah.
But there are some, chemical-based sunscreens like Elta. They've got
Elta
some.
has a good one.
And they're still like, high in their percentages. Their active ingredients. When you look at the active ingredients, something over the counter, it's this big. And they're, so there's some still really good ones, but I just tend to go towards a mineral.
Yeah. I think part of it too is when, at least I was growing up, the mineral sunscreens were thick and pasty.
Yeah.
And I think that a lot of people, at least in my and our generations, just still think of that when they think of zinc sunscreen.
Yeah.
But the ones out now, you don't, I put it on in the morning and it's like a lotion, you know, and then that's it.
Yeah.
And a lot of them are tinted for women who, are concerned about not wearing any makeup or things like that. So Color Science is a really, really good one. It's one of our favorite ones. And there's so many options for skin type, skin color, that type of thing. So
So there should be no excuse for reapplication.
Yeah.
No.
There's even a powder. You can leave the powder in your car year round and you can apply it. You drive in the back of your hands, dust it on your face, and you can go over makeup. There's literally no excuse.
No.
Yeah.
You can't get one by me.
I agree. Yeah. I agree.
You should ask my kids how I feel about sunscreen.
Yeah.
And everybody else.
Yeah, same. It's tough when they're heading to soccer practice to talk them into it.
Oh, yeah. Yeah.
Like, you don't want to go through a bunch of lasers when you're in your practice.
Yeah. Well, I'll even tell like the younger gals that come in, I'm like, you don't want to see what my prices are going to be like by the time that your sun damage starts to form because you're tanning for a month before you go to the beach. Don't do that. Don't do that.
Yeah. How should someone adjust their at-home skincare routine as we head into a different season, a cooler month, drier month? Go see their esthetician, or is there sort of generic?
With me personally, I usually talk to my patients about, okay, let's talk about what we're using during the summer.
Okay.
We're going to, most of the time, change your moisturizer. Cleansers are a dime a dozen. As long as it's not breaking you out, you're getting your makeup off, you're getting your day off, we don't need to change your cleanser. But most people like a heavier moisturizer at night, especially in the wintertime. So, I'm not trying to sell you another moisturizer or anything. It's just we need to adapt to those changes. Sure. And again, samples are so important. Let's make sure that you like it. Let's make sure that, it's not breaking you out or clogging your pores or things like that. Yeah. But, good skincare is adaptable. So it is a must. Yeah.
Yeah.
And
right for you.
Yeah. And I usually really educate my patients on like a good hyaluronic acid too, which hydrates your skin more from the inside out and
but this is applied topically.
It's a serum. Yeah. And so it just helps if you're feeling like my moisturizer's not cutting it enough, but maybe you need something that goes more into the skin.
Okay.
And not everything, there's a lot of things over the counter, and so you really do need to speak to a provider about something specific. So you can.
I feel like people have to get overwhelmed when they go to the skincare section.
Yeah, it is.
Yeah.
It's insane.
Well, I feel like they buy a bunch of products. They're not educated on how to use them. They don't know what they're going to do.
Yeah.
Or TikTok.
And so we're very passionate about making sure that you understand when to use this, how to use it, how to stack them, how to apply them, when to apply them.
And why they're doing it.
And why it's important.
Yeah.
The why is the big thing.
The why is the biggest thing, for sure.
Yeah. And sometimes less is more. Sometimes they don't really need, a basket full of products and, sitting on your sink. You could just need
Less
a few
is more.
things. Yeah. Sometimes less is more.
Yeah, got it. I was thinking of doing the TikTok of the people who do their skincare, regimen.
Yeah.
Mine's like 2 things, so it'd be really quick.
It shouldn't be 2 things.
Oh, shoot. Let's back up for a second.
So next question. What do you use, Dr. Spaniel? We'll circle back to that one.
Yeah.
Maybe when you're not on mic.
Let me do some homework. So when people get a laser or BBL, some sort of a treatment, how quickly do they see the improvement? I mean, you mentioned the hydrofacial is pretty immediate. What about the other therapies?
That's a pretty loaded question. And I guess the best answer for that is everybody responds differently. And so it's really hard. If there's one thing I've learned throughout the many years I've been doing this, 16 years or so, that you really want to paint the picture really big for my patients and everybody is because not everybody's going to respond the same way. You're not going to respond the same way as somebody else or your friend or your sister. And so everybody's lifestyle is different. So it's hard to predict that for everyone. But on average, we kind of go by what we were taught in our trainings and what we're educated on post-procedure. Usually with a halo, your anti-aging results peak around 90 days. I tell my patient usually around 2 to 4 weeks you start to see the halo glow, which means the pigment's been lighter. And then by 4 weeks, most of the dead skin have sloughed off, so you start to see that new skin come through.
You said by 4 weeks?
Usually by 2 to 4 weeks.
2 to 4 weeks.
Yeah, you start to see that halo glow, and then anti-aging. And then even with products, sometimes it takes a full month or sometimes even a full bottle of whatever to kind of see. So,
6 to 8 weeks to get like a tretinoin or a retinol into your bloodstream. So patience is key.
Sure.
And consistency.
And consistency.
Yeah. So, it just varies. But, obviously the lasers are working. They're going into the skin. If you can feel it, it's working. It's just a matter of you're so unique to you and how you respond. I'm sure even maybe with some of your plastic patients, some people bruise really bad. You just can't predict if they're going to bruise crazy or not, or they're going to keloid or, it's just so hard. But you prepare them for, realistically, this is what you can expect.
Expectations.
But.
Okay.
Yeah.
Yes. Good. And speaking of time to result, you both mentioned an excitement over Moxie, and it's a non-ablative laser.
Correct.
And so why are you so excited about it?
The results that we have gotten with this Moxie, it's great. Again, great for every skin type. It's a great first time laser person if they've never been experienced to a laser. It is great for that.
Dipping their toe in the pool.
Getting them a little used to that, getting them used to the numbing, getting them used to the heat of the laser.
Seeing how their skin responds.
Yeah. And it's very buildable. You can build that treatment.
Is it usually one and they're good for a while, or is it a series
You can do, we recommend a series of 3.
Okay.
It's safe to do 4 weeks apart.
Okay.
You can do it 60 days apart or 90 days apart. I'm a big believer of let's do 3 1 month apart. It's kind of like you want to lose 20 pounds. We're not going to the gym once a week. We're going 5 days a week. But again, everybody's different. Price has a lot to do with it. And then the downtime too. But Moxie is very, 4 to 7 days and you're good to go.
Yeah.
And even the downtimedness of the downtime is not too bad,
No,
right?
it's flaky.
No, it's easy.
It's a little pink. You're a little red. That heat
makeup
dissipates.
on the next day.
Yeah.
Oh, wow.
I think your wife had sunscreen on like that next morning, tinted moisturizer, because she had a meeting or something, and she had a teeny bit of pink, but you couldn't even tell that she had much done. So it's
an easy recovery.
Really
but
easy recovery.
You're still getting a little bit of everything, You're still getting a little bit for texture, pigment, a little bit of tightening. So it's a little bit of love. It's also a great maintenance to a halo. Maybe 6 months later you do one to kind of, piggyback up against your halo.
Whereas the halo would be annually.
Once a year, maybe twice a year.
It depending on the person.
Just depending on the person.
Ideally once a year.
Yeah.
Okay.
Yeah.
And then sometimes we combine with the tops of hands, right? So are all the therapies we discussed options for hands as far as the laser?
Do it
anywhere.
Well,
but sometimes we do
Not everywhere, but
most places.
most places.
but often like a special will include hands, right? If we do neck or face or something, like
we do include hands in a special. Yeah. But you can always add the hands on.
Yeah.
Okay.
Absolutely.
I think hands are an easy way to figure out the age of someone. I think.
Yeah.
I was scrubbed in surgery with a new CRNA I hadn't met yet, and she had her cap down and her mask up, and I could tell she'd had some Botox and filler, but I was guessing like how her age, and then I saw her like reach and move the drape down, and I saw the top of her hand. I was like, oh, she's at least 40.
Yeah. And yeah,
So
my hands
thinking about
are
the hands too when we're treating this stuff.
Well, and think about how much of a beating they get when we're driving.
Driving.
Too,
Right.
And nobody's, like I try to put products on the back of my hands, but
no. And even if you're good with sunscreen, you're probably not good with that.
right.
Yeah. The most common add-ons are like face, neck, chest.
Face, neck, and chest.
Usually people start with the face and they add on the neck and they're like, oh shoot, my chest. And so those are the most common ones, but we still do quite a bit of hands and, body for the pigment on the legs and arms. And so.
Yeah. Nice.
Yeah.
Love it.
Yeah.
So what are some top 3, if you have top 3 of this, must-dos as we transition into fall and winter?
Well, I think we touched on our
lasers
kind of our favorites.
Tret, staying on, that.
Yeah. Treatment wise, I would say Halo, Moxie, BBL are probably the top 3 to do. Not that any of the other ones are, not as important, depending on your downtime, but those would be the top. And
And then
Tret.
your Tret and skincare.
Yeah.
Okay.
Yeah.
What about any good like patient stories? Patients who were, notable that had a exciting result or something,
Oh, I mean, I feel like we get a different variation of that every time somebody lays into the bed, on the bed.
Sure what you want me to say.
No,
that I could say.
We hear a lot. No,
that they were ready, they felt more than ready for a wedding or something.
So I had one actually today, right before we came here. She had gone through some cancer. She was getting injections. She was just not feeling good about herself. And she didn't know this world at all. And she's older, and it was very much hand-holding, which that's just kind of the esthetician I am. I don't mind that. I love doing that because I want them to get the best experience out of it. That's just the type of esthetician I am.
Sure.
And today she was just like, I feel like she did one Moxie. We've done some hydrofacials, got her on a whole skincare regimen. And this woman is just glowing and she's so happy. And she had this one Moxie done in April and had a wedding and was going to see her ex-husband. And so I asked her today, how did it go? And she's like, I feel like, does it do the same thing as Botox does? And I was like, well, no, they're 2 different monsters. But she's like, I just feel tighter and brighter. And there's nothing better than hearing something like that from
hearing a good revenge story.
Good revenge
we hear a lot
story,
of those. Or just that they went to their reunion and people are like, your skin looks so good. And so that's probably one of my favorite lines I hear is how good that they look to other people who haven't seen them in a while, or even people who see them all the time, like, I just can't put my finger on it, you've done something different. And it could have just been a facial, but
it just look good.
It just look good. Or I get texts all the time from my patients like, what did you just put on my skin? I love it. And I'm like, well, the treatment really worked, and they leave with such an immediate glow, or they see that down the line. And so it's fun. It's fun, and it's like I said, it's always just a customized thing for people.
Sure.
It's fun.
And I think it came up on the podcast with Ashley and her patient about, she does these things for herself. It's hard to fill other people's buckets when yours is not full.
Right.
And
100%.
investing in yourself, you're able to put more into everything else.
Well, when your cup's full, you're better for other, your kids and your family. And
when a friend sees it, or a husband sees it, or somebody else sees it, I think it just reassures you that I'm doing something really good for myself. And it allows you to want to do that for yourself more.
Well, I always say, just even laying still and doing nothing for a little bit, it's almost better sometimes than the treatment, just getting to lay still. And, I had a patient yesterday and she was down for a facial, and she had just been running around doing so much, and she was just really looking forward to, this was her moment to lay down and just let her mind just stop racing. She wasn't going to answer the phone. And so it's just little things like that that are fun.
I love that. There is a spa experience that I often forget about. I think about so much the medical part. It's really is.
We want you to feel good. And
we do. We're doing the medical part for sure, but it's definitely, we want everybody to feel special when they come in and when they leave.
And I think you do too.
Yeah, thanks.
As people are looking for estheticians, what should they look for? I mean, you turn around every corner, I feel like there's someone who's got some device or products or a med spa. What should people look for when they're shopping around?
I tell my patients who are moving, and they're like, what should I look for? Because I want to continue, these services. And I tell them to find a place like plastic surgery or dermatology, find a place where the doctors are in-house. There's something about a doctor being in-house right next to you, your nurse injectors being in there. I feel like we all collaborate well with each other. Even when we get pulled down to consults with you guys, there's just something about the doctors being in-house that I think is very important. A lot of these med spas don't have doctors on staff. And so, I think for just if we were to need somebody, it's good to know that you're there, but then also just to pick your brain if we've got something that we just, or what if something happened, and it's just nice to have you guys so close by. I think that's important. And medical grade things. So, yeah.
How would they tell looking on the website?
So anything by a licensed esthetician, dermatologist, plastic surgeon is going to be medical grade. So anything you can buy over the counter, Sephora, Ulta,
TikTok.
Target, Walmart, TikTok, that's not,
beef tallow?
it cannot.
What?
Oh, don't get me started on the beef tallow. That's gonna be a whole nother hour podcast.
The slug thing.
Yeah.
Oh god.
They were collecting the slug juice?
Yeah. Don't do that.
Please don't. And please don't put beef fat
No, don't do that either.
on your face, which is what tallow is, in a pretty jar with
In
a
a pretty
pretty
jar.
label. Let's
With a
just not.
pretty TikTok gal on the other
Yeah,
end. Just
she ain't using that.
Works. Yeah.
She ain't-
and she's getting paid for it.
Yeah.
Why? Because we're technically getting
So
paid too. But
you've had patients bring these to you, these things?
Yeah.
Okay.
Yeah.
I bet you got a good story there.
well, speaking of patients coming in buying things online, I've even had patients buy a Obagi moisturizer, hydrate. And she was like, oh, I got this online. I found it. It was like $30. It was super cheap. It was great. And I go, oh no. We hear that a lot where people, and like, it looks just like Obagi. And it did. She showed me the bottle. I pulled our Obagi from the counter. I pulled her Obagi, and we looked at the ingredients on it. And the first half lined up, but the last half did not.
Interesting.
Do not buy your
Yeah.
products just because it's cheaper, or you're getting not a real authentic
You're not getting-
cheap product. And then we can't monitor that.
Sure.
So it's so important to buy those things in-house.
Yes.
Yep.
So
Yep.
I learned that recently that I was getting my hair cut, and you can buy Aveda packaging, like from whoever makes the packaging for Aveda, and then put your own stuff in it. Yeah, like the person cutting my hair told me this. She's like, so only buy from like a license, which I was doing anyway. But
which again is
same
a whole
idea,
other podcast.
which I just had never thought.
Yeah.
Anyone could go buy.
Well, the bottle looks like it.
Yeah.
So yeah.
And I think it's important when I do talk to my patients about medical grade skincare is that, and I didn't know this till years ago when I went back to school for this, but anything that you can buy over the counter is going to be FDA approved, but they are not monitored by how much of a retinol. They can claim that there's retinol in there.
But it's
And there
safe
might
for
be, but it's
everybody to use
a
it.
minuscule amount. So there's a lot of alcohol in those products. So it cannot physically change the structure of your skin. So something that is medical grade, doctor, esthetician, dermatologist is completely monitored on what those ingredients and how much of those active ingredients are in there. Yeah. So
That makes sense.
yeah.
But yeah, a lot of people don't know that.
No. And it's okay. We're here to
Yeah,
tell you that.
and that's what we're here for. Yes.
I think you do get what
There's
you
no
pay
judgment.
for too.
You do.
Yeah,
You do.
yeah.
And when you're using medical grade products, you will use so much less.
Yes.
It will go so much longer. That cleanser should last you well over 3 months as
Yes.
opposed to a month maybe.
Right,
So
right.
that's important too.
Yes. Fantastic. Any other final thoughts, words,
Come get your
suggestions?
laser.
Yeah.
It's laser season.
Yeah.
Awesome. Well, thank you, Jess. Thank you, Sharina.
Thank you.
Of course, thank you.
Thank
This
you.
was fun.
Yeah, this was fun.
Yeah, this was fun.
Yeah, we'll do it again.
Yeah, definitely. Thanks.
This has been another episode of The Aesthetic Angle. Thank you so much for joining us, and we'll look forward to seeing you next time.